Dr. Jawahar Shah, good morning, very good morning for you.
Roman, a very good morning. And it's nice to be here with you on your silver jubilee year. You know, it's nearly 25 years back we had met in Israel, and it was such a wonderful experience. And I was surprised and shocked that you have still preserved that audio Sony cassette till date.
Yes, it's here.
That, that's amazing. That is amazing. That means you are a very good collector of things. So any area in which you become a collector, I think it will break all the records.
And when I started homeopathy, you have been a homeopath for 20 years. So altogether, if we are celebrating 25 years and I'm celebrating 25 years of my practice, so you actually 45 years experience homeopath.
Right.
Can you imagine? So my question to you, first of all, can you share how you started your homeopathy? When and why you choose homeopathy for you?
See, Roman, it's a very interesting thing that our family has been into homeopathy for last 5 generations. So homeopathy has been in our blood right from day one. And you'll be surprised. We have been brought up 99.999% only on homeopathy. And that is why you can see my hair are still black and they are intact. And the credit goes to homeopathy. I have not colored them. So that is, and at the age of 65, I have got so much energy of like a 16 that I can continue working. And that is why homeopathy. So we have been into homeopathy for ages, and we eat, at least me, I eat, drink, breathe, and survive only on homeopathy.
Yeah, very nice. And uh, do you remember this first? I understand that you were born in a homeopathic family, but do you remember your first own thought about homeopathy? About why homeopathy?
See, I'll tell you very simply. We knew as children, as we grew up, that homeopathy works. And when something works, there is no other choice but to choose what is the right thing. So, based on that, we had taken a decision. My family had taken a decision. I personally loved, you know, excavations. I love history. I love to travel. I love to, uh, you know, I would have been an archaeologist. That was my also passion. I love history and archaeology. I can spend days and months and on any of the good architecture which is there in the world. So that has been my passion. But when it came to profession, I thought that it is better to do what is going to serve humanity. Because by being archaeologist, I'm not going to serve humanity. So I chose to be a homeopath.
And can you tell us in few words what was your homeopathic way where you started to study homeopathy with whom? Who were your first homeopathic teachers, schools, and so on? It's
Yeah.
very important. It's very interesting.
See, I started my basic education with one of the base schools of homeopathy, that is uh, Bombay Homeopathic Medical College. And we had wonderful teachers, amazingly good teachers. Our Materia Medica teacher was Dr. Hiranandani, Dr. B. Patel. And I still remember they used to make the Materia Medica so live, so interesting. And we had Dr. Samant and Dr. Kishore Mehta who were teaching philosophy and organon. So my base subjects were so good and I loved the subjects. Like suppose even if I have exam in philosophy, I'll be teaching other students Materia Medica, you know. So that was the kind of love for homeopathy. And my base was always a Materia Medica. I found it so fascinating that so much of beautiful human expressions were there. So many varieties were put. So Dr. B. Patel taught me so much of beautiful things that even today I remember the remedy. You know, he would, in those days, we didn't have computers. So he would start from the top of the blackboard and go on till the last point, and he would explain as if the whole remedy is coming alive. So that was my basic education once I graduated from the college. Then I joined of course, we had hospital training with the Cooper Hospital, and I joined for a short while with Messina Hospital. And then I joined my post-graduation with Dr. M.L. Dawle. His three generations are allopathic doctors, MDs, converted to homeopathy. And whatever I am today, I can say that Dr. Dawle made a man out of me. He was such a tough guy, tough guy. And that was my best experience of life, 3 years with Dr. Dawle. And we would start our day at 8 o'clock in the morning. And sometimes we would end it at 1 o'clock, 2 o'clock, or 3 o'clock in the night. And he was so particular that he would be the first one to be in the clinic at 8 in the morning. He would drop us at the railway station around 2 or 3, and we had to be there in the morning at 8 at his clinic. That was the thing which made me tough. That was the thing which made me a good patient homeopath.
And do you remember your first case?
I remember the first cure case so beautifully.
Please tell us. Please tell us.
I used to always wonder when learning, everybody used to say that everybody used to say single dose, minimum dose, no repetition, single medicine. But I had yet to see some real cases in which the medicine would work so well with single dose. So this was a lady who came to me for bronchial asthma. And I still remember she walked in. We took the case. I started the case. The case was going on. Suddenly she got up from the chair and she ran out of the consulting room. Now, it was my beginning of practice. And, Roman, you can't afford to lose a case. You hardly get a case and you can't afford to lose a case. So I said, Mrs. D'Souza, what happened? I ran out behind her to my waiting room. She was just walking out of the clinic. I stopped her. I said, Mrs. D'Souza, what happened? So she said, you are asking me too many personal questions. I said, in homeopathy, this is what is required. This is what will allow me to practice good, correct homeopathy. And she said, no, you can't ask me so many questions. It is too difficult to answer. My personal things I will not answer. So I convinced her. I got her inside again. I said, no, we will not ask you personal questions. So I started taking interview again. But when you are just 23, you are very naughty. So you can't be straight always. So I asked her again something personal. Again, she got up. And I, like an innocent chap, kept my mouth shut. I said, what happened, Mrs. D'Souza? I did not ask you anything personal. No, 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 you can't ask me personal. The interview went on for about 45, 50 minutes. Hardly there was anything from the history. But she said a very, very wonderful thing, that my asthma is better by throwing my head backward. Now, that was the only symptom she said, which was very specific, peculiar, queer, rare symptom. So I took that symptom, and based on that, I selected the remedy. I mean, with other symptoms, of course, coinciding, but I selected the remedy, Hepar sulf. Now, the potency was also a problem in those days. I was just a fresher. So I said, this lady is not going to come back again, because, so being a little, most of the homeopaths, we are very intelligent. We are very intelligent. To be a homeopath, you have to be little extra intelligent. So then only you can succeed. So I called my compounder. I said, get me a dose of Heparsol 200, because the sensitivity was high, reactivity was so high. So I said, nothing doing. You need a potency which is not very low, not very high, because if you give too high a potency, she would react, because she was suffering from asthma for last 15 years, 14, 15 years. Sorry. So I gave her Heparsol 200, and Roman, there was a surprising reaction. She never ever came back to me. That was the first time and last time I saw her. First time and last time. But after 3 weeks, I started getting many cases, not one cases, many cases, 15, 20, 30 cases of bronchial asthma. I was surprised. They used to say, Mrs. D'Souza has referred you. Mrs. D'Souza has referred to you. My practice started setting up very well. One particular morning, another patient who referred D'Souza, Tina De Silva, I remember the case so clearly. Tina De Silva came. So I asked Tina, what happened? This Mrs. D'Souza doesn't report to me, but she's sending cases. She said that Mrs. D'Souza is completely recovered from her bronchial asthma. And that was my first ever cure with one dose, single repetition, one medicine. And I remember this case for the lifetime. Then I asked her, I explained her the whole story. I said, this is what happened. I asked personal things. And why did she run away? So then Tina said, she's a multi-millionaire. Her husband is very rich person. And they have a huge apartment, huge. And husband is out on a business most of the time. He's out on a business. So this lady is staying alone. So what she does, she calls her boyfriends. And she has 2 doors to the house. So if somebody comes from one door, she packs off the other person from the second door. And that is why she never wanted to give her private history. And that is how she's referring you the cases. I was so happy. And this continued for many years. She would keep on sending me bronchial asthma cases. So friends, never, everything is an opportunity to do something and get to the next level and never give up. That's the philosophy I learned at that point. If I would have given up, I would have allowed her to go home. I would have lost my beautiful case. She would not have been all right. So this was my first Roman.
And as I know, if it would happen, then you will not become a specialist for treating bronchial asthma cases with homeopathy. And as I know, you are one of the prominent homeopaths who has a lot of experience in this field. And we will talk a little bit later about it. You know, you remind me something very interesting. And as a homeopath, we are looking for similarities. So I am listening for this case first time from you, and I am trying to connect things. And actually, I even don't need to connect them; they are connecting by themselves. I know that you are treating a lot of patients with bronchial asthma, with lung diseases, and it was your first prominent case you remember.
Yes.
I remember my first case. Actually, first case was a case of one man who wasn't able to walk because of severe sciatica, severe pain in sciatica nerve. And I remember that day I went to him, to his house, and I was shivering, you know, I was, because it is a first case, you know, it's like, okay. So I took a case, and usually you take an acute case or subacute case for 40 minutes, 20 minutes, sometime plus minus 5 minutes more or less. I sat with this man about 1.5 hours, and I tried to receive everything possible. And then I came home and I worked on this maybe 2 or 3 days, and I brought him the remedy, and it cleared up that his pain appeared after exposure to a strong wind. So I brought him Aconite 30C, and it worked. It worked.
Very nice.
And now similarities with your case. First thing, the wife of this man brought to me many cases, and it was like, okay, at those time we didn't have internet and we didn't have promotions capacities. Right. So in order to receive cases, you had to be successful in your first one. This is the one. And the second, you know, for me, for many years, it was so interesting, the acute treatment of acute cases. And even now, when we reconnect and when we renew our friendship, I would say it came from this area, from treating acute cases in COVID.
Yes.
So tell me, please, your experience with this pandemic and almost 1.5 year of your very active helping people with homeopathy.
You know, Roman, this is very interesting. You are touching my both extremes of life. One, the beginning of the practice, and one as of today, a long 45 years, and you are touching both the extremes.
But you know, homeopathy is timeless. So we are timeless in homeopathy.
Absolutely. So, you know, this pandemic has been a very good learning lesson. I have been a reasonably good student in learning. So when this came, the first time when the lockdown happened in India, it was March, I remember. And in March 21st, I remember it very clearly, 2020, March 2020, everything stopped, entire India stopped. So not going to clinic, not doing anything, and only with special permission you could go out of the home. By April, my patients started dwindling. By May, hardly any patients. But, you know, being a fighter, I thought, let me start working on COVID patients. And looking at my work on bronchial asthma, COPD, I was taken up by the government of Maharashtra as one of the first person to be a first homeopath to be on the COVID task force committee. And that we started working on COVID patients. And in my practice, I found, because of so many years of experience, that ars alp and ars iodide both work beautifully as a preventive. And Roman, you'll be surprised, as a goodwill gesture to give it back to the society, we distributed 1.2 million immunity kits to the people across the globe. We helped the health workers, doctors, nurses, police people, because police had to be on round. And you will be surprised because of this. The Special Security Force, which takes care of the chief minister, 400 of them, we gave them preventive, and you'll be surprised that
Wow.
only 5 or 6 got COVID. We gave it to fire brigade people, we gave it to fruit vendors, vegetable vendors. You know, uh, we gave it to the people who were picking up garbage because we wanted to serve. And you'll be surprised that the excellent response. And Asia's biggest slum, that is Dharavi, we brought it down from 2 digit. The entire thing came down to less than 1 digit, and it was considered as one of the best response which has occurred in the history of medicine. So this is what we did for the COVID as a preventive, and we
Wow.
treated many cases in the COVID. And I'll tell you, even in the second wave, we have come up with very good results. Sorry, you'll be surprised, something very interesting which we have done in last 16 months, that we have been working from morning 3 or 4 till night 10 o'clock every day. And we have come up with a beautiful repertory on COVID as a particular, as a disease. We have come up with a special repertory. We have come up with a COVID app, which is very useful, which we are distributing it absolutely free. So this is what we have happened. And in this way, I have personally treated more than 100 patients, and only one was hospitalized. Only one patient was hospitalized. That was only for 3 days. So we have treated, and we are coming out with a lot of other things to help COVID patients, because the purpose is to give it back to the society. Purpose is to create something different for the world. And I thank you for asking me the question, what have I done in the last 16 months? I have done this.
Yeah, it's obvious because I knew from my sources that you were very active in helping during this pandemic, and it is so interesting to share experience. You know that last 14 months we are dealing with hotline, and we are helping people all around the globe with acute states. And to know that you created this application, and to know that it could be helpful for many people. And I'm in contact with a lot of homeopaths all around the world. This is a time to come together. This is the time to unite our capacities, our desire to help.
Yes.
And I'm very glad that we can do it on the next level. It means not only several groups all around the globe can come together with ideas. It could be that we are discussing these ideas and find the way to applicate it in everyday practice.
Yes. Yeah, results are the most important thing. Any theory has no help, but a good result is equivalent to 100 hours of theory.
Yes. So now I will ask you accordingly what you said, a good result. Please recollect the most prominent case or one of the most prominent cases in your practice for all these years. What just now come to your mind?
Uh, See, Roman, I'll tell you very frankly, homeopathy has always surprised me. Always. Uh, you never expect something and it just happens. I mean, I have a bag full of wonderful cases with reversal, with evidence, but I'll share you a very interesting case. A case of a beauty queen. She was a beauty queen. She was beauty queen in Navy. She was, one of the forerunner in Miss India contest. She would have become probably one of the most important participant for the world contest. She was just 18 when she entered my clinic. When she entered my clinic, I thought she was so beautiful. My assistant had a, had opened a wide mouth and wide eyes. She was that beautiful. So when I saw her for the first time, for a second I thought she had few pimples. So I thought that she has got the pimples and she has come for the treatment of pimples. But when I started taking the case, I was surprised. I was surprised. She had a kidney failure, and the doctors had said the kidney will have to be replaced. It was a shock of my life. Such a beautiful girl has to go through a renal transplant. And in those days, I remember it must be around 40 years back, renal transplant was not that very common, was still a problem. The technology had not evolved. So I started taking the case. And trust me, in 1.5 hours, which I spent with her, it was one of the most amazing experience of my life, where she said many, many important things. And when in anything, if you want to treat, you have to know the core of a case. Once you know the core of the case, the periphery matches automatically. So we touch the core, we touch the cause, and we could treat this case beautifully. These people were working, the father was working for United Nations. You know, can I share the case in detail or just a short one?
Yeah,
Okay.
we are timeless, just it is very interesting, everything you tell. Yeah,
So I'll just tell in relatively shorter way.
yeah,
The father was working for United Nations. And as he was working for the United Nations, they used to travel from one country to another country to the third country, and they would keep on traveling. And this little girl, she was just hardly 2 or 3 years old, and it was a big shock to her. It was a big, big shock to her. Because in one country, they will speak different language, another country, they will speak different language, in third country, so school, she will keep on changing. And she being beautiful from childhood, she got all the attention. Now, if you remember that when you go to a party, when some dignitaries are present, you have to be very, very disciplined. Like a British people, like German people, very disciplined. You have to pick up one particular hand for the fork, one particular hand for the knife. And this particular child, 3, 4 years, was so much discipline, so much discipline. So there was a lot of suppression of the emotions. Plus, they were vaccinated so frequently. Going to a country, again vaccinated for different things. African country, you vaccinated for yellow fever, malaria, and so many things were there. So, the trouble kept on increasing. I mean, vaccinated not for malaria, vaccinated for yellow fever. So, she developed blood pressure when she was 13 or 14. She was thoroughly investigated. Then they settled down in India. The father took a voluntary retirement. They settled down in India and they were diagnosed with hypertension. So investigation showed that one of the kidney was totally atrophied. The second kidney was absolutely working at a lower level. So they said it had to be replaced. The important part of the history was she was so beautiful. She had boyfriends, many boyfriends, and she would treat the boyfriends absolutely roughly, you know, as if she's the boss. She'll say, "Get my shoes, get my nail polish." And she, being so beautiful, any boy would do it. So this was the case. Then I always make it a point when the parents are around, I make the patient sit outside. So I talked to the parents and something interesting came up. And that was really something amazing. Mother said that she has got schizophrenic traits. She listens to the voices from the next door apartment. She listens as if people are in love. People want to come and have relationship with her. And the third thing which mother said was something unbelievable. She said that she has attraction even for the same sex. So she gets attracted towards girl also as much she gets attracted towards boy. And this was the key which opened the prescription. If you refer our repertories, Materia Medica, you will understand a beautiful, arrogant lady, and she has love for the same sex. The remedy is platina. And this was the most surprising thing of my life. We gave her platina 201 dose. The blood pressure started coming down. We must have repeated only 3 or 4 doses of platina 200. And we did in one of the biggest hospitals. They had been to Bombay Hospital. They got the investigation done before the treatment. They got the investigation done after the treatment. And the response was that both the kidneys were functioning 100%. Now, I could never believe atrophied kidney, these are the documented reports, atrophied kidney working 100%. I can understand a normal kidney working 100%. And trust me, this was my absolutely amazing eye-opener case, which I never could believe that just 4 doses, what is the cost of that 4 doses? Not even half a dollar, not even 50 cents. And this opened my eyes that if homeopathy can do so good, but Gordon, sorry, my apologies. Roman, uh, we have to make this reach every home. The problem is that every home should talk about such cases, such incidences. Then only will homeopathy go up. unless it is demanded by people.
I agree with you for 100%, and this is our aim. Um, maybe this is the most important thing. I remember, as all of us, the first words of the organal, first paragraph, the highest and the only role of the physician to restore health. If we are taking now to consideration that humanity is ill, and we have to be modest, but to be modest is to know that the tool we have in our hands and in our hearts, homeopathy, can treat people, can help without borders, and that's what we are going to do. And I'm very happy for our one more meeting and collaboration. And I would like to.
And Roman, another very wonderful thing. Just imagine if she would have gone for kidney transplant, how much of money they would have spent, how much of torture the family would have gone through,
how much of suffering.
Yes, and yes. And if they are, I always say that if we are able to relieve one such case in our lifetime, done.
Great.
And trust me, the kind of sleep which we get when you do such a good work, it's amazing. I touch my pillow in 30 seconds to 3 minutes. I'm fast asleep. Because your heart and your head is in a state of happiness.
Yes, I can feel it. So I prepare so many questions, and actually we are only on in the beginning of our conversation, and I suggest, if it's okay for you, that we will do such series, because we will not cover all these questions. For example, what is the ideal homeopath for you? What is ideal student for homeopathy for you? And what the evolution in homeopathy you had seen for 45 years, and what are your plans, and what could be done? I have so many questions, so we will meet, I suggest, once in a while. But meanwhile, it's very important that we are going to arrange a special webinar from you, because you are one of the most prominent specialists in homeopathy and bronchial asthma. So the first webinar we are going to do is treating bronchial asthma cases by homeopathy, and it will take place at 18th of June. So we invite everybody, and maybe in 2 words, can you tell what homeopaths, as students, as experienced ones, will receive during this webinar?
Roman, it will be my great pleasure to be with you, and I will share my heart out whatever I have learned in last 45 years. And I'm sure and I'm very confident that if they attend this sessions, honestly, they will be able to help most of their cases of bronchial asthma.
Very good.
Even in the acute and chronic phases.
So, Dr. Jawahar Shah, thank you very much. Thank you for your patience. Thank you for your enthusiasm. Thank you for your example. And see you in this series and at the webinars. And I hope we will see each other face to face in a very close future. Thank you very much.
Thank you, and take care. Shalom.
Shalom. Bye-bye.
Bye-bye.